The latest on the coronavirus. We cross live now to our colleague Chriselda Lewis is standing by with the MEC for Health in Gauteng. Chriselda, what's the latest?
All right, Desiree, very good morning to you. We took the opportunity here at the post-State of the Province address, a briefing called by several MECs here in the Gauteng province to ask the health MEC what the latest is regarding the second patient, you would recall, who tested positive for the coronavirus. That one, of course, receiving treatment here at the Charlotte Maxeke Hospital in Johannesburg. You would know that there were 3 hospitals that were set aside, to deal with the coronavirus. Charlotte Maxeke Hospital, Steve Biko Hospital, as well as Tembisa Tertiary Hospital. So those 3, this one patient, of course, was receiving treatment at the Charlotte Maxeke Hospital. We understand from the MEC is doing well, and the department is hoping that this patient might be discharged by the end of the week. The health MEC saying he's satisfied with the tests thus far, but of course they'll continue to monitor the situation. Let me bring him in very quickly. Dr. Masuku, thank you very much for your time this morning. Just a very quick update again. The patient who is at the Charlotte Maxeke Hospital, the condition you said is doing very well.
She's doing quite well, and she's less symptomatic, and we are now running the few tests that we do just to ascertain that the virus is off actually her body. And we are going to also visit her just to also ascertain with the public that she is doing well. And it's one of the ways that we are trying to demonstrate to the public that yes, this outbreak or this disease is actually curable, because other people have tended to equate it to death, and it's something that we shouldn't actually spread. We should also talk about that it is curable and it is something that is manageable.
Dr. Masuku, so as it stands, is there no further detection of the coronavirus in her system, or are you going through the last phase of the test to determine that?
We are doing the last phase, and I think she will be required to do the last test, I think, on Thursday or so, because the one that will be done today, this morning, and it will be one that actually indicates to us that it is actually she is ready for for discharge, and that she is getting ready to be, because the test must be actually negative. Yeah.
So at this stage, not negative yet?
At the moment, it's not yet, but it will be, I'm certain, from the ones that will be done this morning. Yeah.
Dr. Masuku, in terms of, I know you mentioned during the press briefing, a team that has been put together in terms of contact tracing to deal with issues like that. On this particular one or patient relating to Gauteng, of course, have you been able to speak to any of the other individuals who came into contact with this particular patient who tested positive for the coronavirus?
Yes, we have been. We have done actually tracing for the people that have been in contact with her. Moreover, that it's something that happened over actually in the weekend, and we are just waiting for the test for some of them to be able to verify if they are negative or actually positive, so that they can be actually brought in. But tracing does still continue throughout the province to make sure that we are able to capture and detect wherever any individual, wherever they are.
All right. So how many of those did you bring in?
No, they are not in the hospitals as yet, because they were tested from home, and their own self-isolation in terms of our own actually protocol that we have given them. So we're looking at around the figure of around 9, and these are people that also include the housekeeper of the lady. Yeah.
Dr. Masuku, I know that you really have to rush. Thank you very much indeed for your time. Dr. Bandile Masuku, who is the Gauteng Health MEC, pointing out there that a patient who contracted the coronavirus, who is receiving treatment at the Charlotte Maxeke Hospital here in Johannesburg, is doing well. They're hoping that she will be discharged by the end of the week. Final tests are being done at this stage to really ensure that those results do come back negative. You heard there about 9 people people that she may have come into contact with were also tested at home. They're still waiting for those results to come back. Contact tracing, very important in this aspect, Desiree, to ascertain the condition, health condition of those that may have come into contact with her. Just a quick update also, Desiree, in terms of the evacuation of the South Africans from Wuhan city, the epicenter of the virus. SABC News this morning understood that there is pre-departure information that has been brought to the South African citizens who are in Wuhan city. They've been sent some documents, and those documents entail, for example, how much luggage they will be able to carry back to South Africa. And what I also picked up from that communication is that they are told that there will be certain meeting points where they'll be told to meet the authorities who will pick them up from those meeting points in Wuhan city and take them to the airport. Just some clarity at this stage. It's not clear as yet exactly when that aircraft will arrive in Wuhan city and when it will come back to South Africa. But what we do know at this stage and what we can confirm is that pre-departure information has now been given to those South Africans in Wuhan city.
Thank you so much for that update, Chriselda Lewis.